Hello, this is Brian Casey, and we are here at ECR 2023 in Vienna. Some of the most interesting research that's being presented at the meeting this week is coming out of Italy. And we talked to several Italian researchers in three major areas: MRI, ultrasound, and artificial intelligence. Here's what we heard. We are here with Dr. Laura Crocetti. She is an MD, PhD, EBIR. She's an interventional radiologist with the University of Pisa. Dr. Crocetti, thanks for being with us today.
Thank you, Brian. My pleasure.
So you're an interventional radiologist,
Yes,
and
right.
you also work quite a bit with ultrasound. Can you talk a little bit about the role of ultrasound in interventional radiology today and also tomorrow?
Yes, ultrasound is really, very important for us, interventional radiologists, in all everyday practice, starting from the arterial access in the angio suite, going to more complex procedure, ablation of tumors, especially in the liver, and nowadays with new ideas of bringing ultrasound guided procedure in other organs than liver, so head and neck and prostate. Every time we can see an organ with ultrasound, and we can see it very well with the high definition, we can ideally bring our devices and treat.
What are some of the conditions that you think that ultrasound-guided interventional radiology is most useful for?
I think that liver for sure has been the mainstay and the main organs where to apply ultrasound-guided procedure, and it will be even in the future, despite all the advancement in other techniques such as 4D CT and MR. I really think that ultrasound will stay probably integrated with other solution, but will remain very important. But I can see, as I told you, that we will move to other organs too. What is really nice and useful of ultrasound is that it's able to provide the real-time guidance, and to me, apart from MR, that is definitely for now more costly, is the only technique that can do this.
What are some key features of an ultrasound scanner that you think are really important for interventional radiology?
As you know, when we are doing procedures, we have many things to care of, because we have sometimes difficult patients in urgent conditions, so we have to be very fast. So the ideal ultrasound system for me is the one that is very easy to use. Ideally with one button, and I have to easily find what I need, Doppler, and change the screen and use different tools really easily and in very fast way. And going on with more complex procedure, what also I would like in my ideal system is the easiness to go through fusion imaging, because fusion imaging is very interesting, but especially in the past has been a little bit too cumbersome for IR that are easy people. They want to do things very fast and easily. So the improvement of the workflow for fusion imaging to me is now very important.
Have you seen big improvements in workflow in ultrasound recently for interventional radiology?
Yes, definitely. The latest release of fusion imaging in Exalted system are really very good. New improvements in how to have the initial fusion with CT, with the external photo camera, easy tuning within, and especially with the artificial intelligence and the improvements in prostate.
Yeah.
So the new softwares are really nice.
Now, you're a woman in interventional radiology. How do you see the role of women in interventional radiology progressing in the years to come?
Yes, we are now very numerous. There are plenty of women doing interventional radiology and willing to do it. We have improvements in the safety stuff, so we are now able to do procedures more safely than in the past, even according to radiation safety. And so I think that the number of women will increase more and more. We need to do a network among us, because this is very important. We have to support each other. We need to have more women mentors, because young women need to have examples to follow. We need to have sponsors. That means that we have to care about our young colleagues, female colleagues, and to help them to build their own pathway.
Great.
For a young.
Okay, well, we'll look forward to seeing that. Professor Crocetti, thanks for being with us.
Thanks, Brian. My pleasure.
Signing off from ECR 2023, my name is Brian Casey.